Gout. It just sounds bad.
Get out. Gout.
Got the gout. Okay, today we're going to talk all about gout. Diagnosis, treatment, all of it.
Okay, and the thing about gout, it's an inflammatory arthropathy.
Yep.
But it's one of the ones that comes on so fast.
Yes, and severe.
Other than a septic arthritis,
Right.
I can't think of another arthritis that just hits you that quickly.
Right, so one joint, all of a sudden it's big, it's red, it's swollen, you are miserable, and you're worried about it.
Yeah, and it often is just the big toe for some reason.
Let's talk about what it is. What is it?
So gout is an inflammatory arthropathy that occurs because of an accumulation of uric acid crystals in the joint.
Okay, so what is that? What's uric acid anyway?
Uric acid is a chemical that you have in your blood.
Okay.
It comes from the breakdown of purines.
Yes.
So there's certain foods that you eat that can put you at increased risk for elevating your uric acid level,
Yep.
which can then deposit into your joints.
Right, so it's broken down in your liver and then usually excreted by your kidneys. So if you have problems with either of those organs, that can cause an elevation. Certain genetic mutations can cause elevations. So now you have an elevated uric acid, and this deposits the uric acid into your joints as well, sometimes into your skin and your soft tissues.
There you go. Yeah, you can get these gouty tophi, they're called.
Yeah.
All right, so let's talk about those foods real quick.
Okay.
Red meats, organ meats,
Yep.
shellfish.
Yeah, surf and turf, just say no if you have gout.
Be shellfish.
Be shellfish.
Protect
Okay,
your uric acid
so you
levels.
got to avoid those foods. Alcohol actually has been shown, unfortunately, as well, to increase your risk of a gouty attack. Other risk factors include being male, having an elevated BMI, and certain medical conditions that affect your liver and your kidneys,
Sure.
diabetes, heart disease.
Hypertension,
Yep.
those kind of things.
Okay, so,
So-
how do these people present? How do they show up?
Okay, that's the thing about gout. It's like all of a sudden went to bed, I was fine. I woke up in the middle of the night with a swollen, red hot joint, and it really hurts
Right.
all of a sudden.
Sort of touch, sort of move, and usually it's one. What's the most common joint that's affected?
Very commonly, it's the big toe.
Classic is the big toe,
You can
the
get
first
in the
MTP
knee, you
joint.
can get in the elbow, you can get in the wrist, you can get it just about any joint.
Right, and we get called sometimes for the knee because people think that it's something more serious. Okay, so now you got your presentation.
Yeah, and it often does present, it gets confusing. Is it gout or is this a septic joint?
Right.
Because the two have very different treatment paths.
Right, so depending on whether you know if you have gout or not, you might go to a walk-in clinic, you might even end up in the ER. So what are they gonna do? When they'll do their history, they'll do a physical examination. Are there any special tests that they can
History,
order?
physical examination, x-ray. We
Right.
always do an x-ray, and we do the x-ray not necessarily to see gout, but to rule out other causes.
Right, but sometimes if you've had severe gout for a longer period of time, you actually have cysts and erosions of the bone because the gout can be so damaging.
Yeah, so that'd be like a long
More of a chronic change. Okay, so you had your x-ray, and you roll for ultrasound, CT scan, MRI.
I think ultrasound is reasonable in certain joints if you're looking for a big effusion.
Okay, so looking for fluid.
And then, I mean, I've heard you can see the crystals on ultrasound. Never ever seen that before.
Interesting. Okay, and so now we've done the investigations. What about blood work? Does that play any role?
Blood work can be done to look for uric acid levels, but it can be deceiving because
Right.
you can still have gout even with a normal uric acid level
Right.
in your body. But if it's elevated, it might tip you off.
Okay, so now we've done the blood work. We still have a high suspicion. What's the confirming diagnostic tool?
Look under the microscope. Take some fluid out of the joint.
Oh, I thought you meant put like the toe under the microscope.
That'll look weird.
So you aspirate the joint, you pull out some fluid. This helps rule out an infection. So as long as there's no bacteria, we know that there's no infection.
Yeah.
But what are we going to see under the
Crystals,
microscope?
Crystals.
Needle-like crystals. For the med students in the crowd, they're long, skinny, needle-like crystals.
Birefringent.
They are negatively birefringent, exactly. So depending on the type of light you use, they have a very specific reaction to that light. So now we got the diagnosis.
Okay, so now the
You've been in the ER 12 hours.
hopefully not 12 hours, but possibly, depending on where you live.
Yes.
So yeah, you've got diagnosis of gout. If this is the first time you've had gout, well, that's the other thing, a family history
Right.
is kind of a risk factor. And if you've had gout before, that
Right.
helps us with the diagnosis this
100%.
time. But if it's the first time now, you got gout, you got the gout.
You got the gout.
Okay, so we're gonna treat it acutely. We're gonna treat that acutely with an anti-inflammatory.
Right, so we said it's an inflammatory arthropathy. So what happens is your immune cells actually attack those little crystals that are forming in your joint, and that's what causes the swelling and the pain and the redness. So an anti-inflammatory, what do you mean by an anti-inflammatory?
Usually indomethacin is the go-to for this
Yeah.
over the years. But I guess you could use any anti-inflammatory.
Yeah.
Be careful with anti-inflammatories because they can hurt your kidneys and hurt your stomach.
And ironically, people with kidney problems have a higher chance of getting gout, so you have to be extra careful. So anti-inflammatory is the first line. What's the second line?
Colchicine. A drug called
Colchicine.
Colchicine, right. Try
Yes.
it. absorb up, mop up, cover up. I'm not sure what it does, but
Yep.
it deals with the high uric acid levels.
Yeah, I did read that recently there's been a lack of availability of the generic version, so the name brand version actually is quite expensive. So colchicine is becoming not a very practical choice for a lot of people.
Oh, that's frustrating.
It is. And then number 3,
Steroids.
steroids. So when we talk about steroids, you mean like anabolic steroids to get?
No, I'm
no.
talking about prednisone. It can be a pill
Prednisone.
or an injection of a corticosteroid.
Right, so this is like a heavy duty anti-inflammatory that you can take orally, which does have some associated risk, but for people with severe kidney disease or liver disease that anti-inflammatories like NSAIDs are contraindicated, this is who gets these.
And think about it. That's why we have non-steroidal anti-inflammatories. NSAIDs came from the fact that we had anti-inflammatories, which were steroids before. Then we developed non-steroidal anti-inflammatories.
Right, okay, so
That's a
now
little bit of history for you.
it's good history of NSAIDs and SAIDs.
Now you know why it's called NSAID.
Yeah, so now that you've treated the acute inflammation, this is going to be going on for a little while. Is there anything else that we do at the same
now you
time?
want to start preventing.
Okay.
Okay. Now that you know, now you know. So you're going to prevent eating those foods that cause it.
Right.
You can't really change some of the other risk factors, but some of them you can.
So don't have a beer, because beer actually is one of the alcohols that increases it. So don't have a beer and surf and turf together.
No.
Bad idea for gout.
Yeah, that's
Okay, so you avoid the foods.
avoid the foods, and then if there's some of those risk factors that are modifiable,
Yes.
we would modify them. For example, if you're carrying too much weight,
Yep.
reducing your weight might help.
For sure. And then one medication that has been shown to help reduce your uric acid level is something called allopurinol, which is a xanthine oxidase inhibitor. So it's a class of drugs. There's a whole bunch of them on the market, but different name brands. But allopurinol is the most common one. And historically, they had said, don't start allopurinol during attack.
No.
But more recent studies have actually shown, that this maybe is not as big of a deal as we thought.
Okay, there you go.
But definitely long term, you need to treat it. And what they would say is this is the first time you've had an attack, you need to treat it for like 3 months. And if you've had multiple attacks, sometimes even up to 6 months.
Okay, so now you know what gout is, you know
Yep.
who gets it, you know how to avoid it, you know how to treat it,
Now you know, you got the A to Z on gout.
or the Z.
Or the Z. If you like this video, please like it, subscribe to our channel. Check out our long form content over on YouTube.
If you've had a crazy gout experience or any gout experience, leave it in the comments. Tell us about it so other people who have gout can read it and say, hey, I'm not the only one with a big red hot swollen toe right now.
Now you know.
And remember, you are in charge of your own health.
We'll see you next time.